हेलो फ्रेंड, दिस इज़ अजित। आज हम डिस्कस करेंगे अबाउट हीमोरॉइड और फाइल्स। सो हीमोरॉइड और फाइल्स क्या होता है? दैट इज़ हीमोरॉइड इज़ नथिंग बट क्लम्प ऑफ वेन इन द इन एंड अराउंड anus and lower rectum when they are swell and bulge, when the bulging formation is there in the rectum portion. And type, कितना type is two type, that is internal hemorrhoid. When the bulging, when the clump is present inside that rectum, that is called internal hemorrhoid. When it is present, the bulge, when that swelling present outside that rectum, that is called external hemorrhoid, others called piles. So this is not a serious condition, but it should be disturb our daily life. So what are the causes? There may be family causes will be there, and spend lots of time in the toilets, and consumption of constipation and diarrhea, and consumption of oily and spicy food, that also leads to cause of hemorrhoid or piles. So what are the symptoms? You can see that particular patient, that is symptoms is painless bleeding. There may be bleeding from the rectum. If you go for rectum examination, that time you can see that there is a bleeding is there in the rectum examination, and separate drop will be there, and swelling and itching will be there. Swelling and itching in that rectum position, or that hemorrhoid position. And what are the investigation that you can perform? That you can perform colonoscopy and far rectum examination. That is the examination that we can do without without any technical process. And sigmoidoscopy, you can go for sigmoidoscopy and proctoscopy. So what kind of food will help to stop that hemorrhoid piles? That is, you should take more amount of water and fiber containing food, that will prevent that hemorrhoid piles in development. So now coming to that, if you go for treatment portion, there will be first option will be rubber band ligation. So, and second is coagulation and sclerotherapy. And if you want to go with the surgery portion, there is surgery portion, hemorrhoidectomy. Roidectomy means remove that hemorrhoid. You can cut out that swollen tissue. What are the swollen tissues formed? You can remove through hemorrhoidectomy process. And second one is stapler hemorrhoidectomy. So hold the hemorrhoid in place. That is the stapler hemorrhoidectomy. And if you want to give initial treatment for this hemorrhoid and piles patient, so the treatment will be what? You can give one antibiotic, that is augmentin. That augmentin is nothing but amoxicillin and potassium amox 500 milligram, and potassium clavulanic, that is 125 milligram. That is augmented. And you can give tranexamic acid 500 milligram, and this brand name is FOS. So what is it will be anti fibrinolytic agent. Tranexamic acid anti-fibrinolytic agent. It will prevent the bleeding from the rectum. And you can give one ointment for local application. The ointment is smooth. The ointment is smooth, and if the pain sensation is there, that time we can give Gerodol SP. Gerodol, this combination is paracetamol will be there, peptides will be there, and aceclofenac will be there. And you can give one tablet, that is levocetirizine or cetirizine. So if necessary, if itching sensation is there in that hemorrhoid portion or rectum portion, if itching sensation is there, that time you can give that levocetirizine or cetirizine. And one more thing that you should remember, this tablet you should give at bedtime, because it is a sleepiness effect will be there in the levocetirizine. And you can prescribe one syrup, that is cremafin. You can give cremafin plus 15 ml at bedtime. So this is the pharmacological treatment for that hemorrhoid, and this about the hemorrhoid. And one more portion that I want to add, that is you have to ask to patient like SITZ birth. Sit birth means the patient should be sit inside that water basin and hot water basin, so it will